Right, good afternoon all. Welcome to this afternoon's Social Care and Tackling Poverty Service Transformation Committee. Any apologies for absence, please?
No apologies, Chair.
None. Item 2, any disclosures of personal or prejudicial interests, please? Alan? No, none. Item 3 is the minutes, to approve the minutes from the 8th of April. That was chaired by Councillor Kerry Evans. Page 1, page 2. Can we have a mover, please?
Yes, I can move that to me.
And a seconder, please.
I'll second that.
Kerry, tomorrow. Can you hear us, Kerry? Can't hear us.
Everybody here. Ask
Can everyone, Alison, can you hear us?
Yeah.
Kerry, can you hear us?
Yes, just about.
I can hear, no problem, yeah.
Want to log out, Kerry, and log back in? Gone. And then we'll move on to
do the minutes.
Yeah.
16th of May.
made a bit of it last night. So the minutes from the 16th of May, which was chaired by who? Right. Page. Oh yeah, the one page. Page 1. Can we have a mover, please? Seconder. Thank you. And then we'll move on to the terms of reference, which is item 4, which is on page, just for information. Thank you. And then item 5 is work plan discussions for 24-25. So we've had a meeting with the cabinet members and the officers. We've got 1, 2, 3, 4, 5, 6. Can't count. 2, 4, 6, 8 items for the work plan. I would like, obviously, for the cabinet members and the officers to indicate the priorities and anything that's ongoing that just needs a couple of meetings just to put the resolution and to seal the business. So we've got day opportunities and use of assets, adult services. That's the first item.
Should we
Yes.
Yeah, so
Are you-
I think as most members will probably know, this is sort of one of the items that we sort of committed to review this year. It's going to be quite a big piece of work, really, and we've said that we want to do it in a co-productive way with service users and ward members, obviously, because day services or day opportunities, as we're going to try to call them, are in everybody's community. So this would be a good item to bring to the committee to get some member input on that as we go through. I don't know if we have a sort of time scale at the moment, do we, Amy? Yeah, just throughout the year. So potentially it's something we could maybe bring a sort of state of the nation, where are we now, report to in the next couple of months, maybe. Sorry, just making work for you. and then I guess maybe scheduling to revisit it once that's ongoing at various points in the year, if that's something the committee is minded to do.
So regarding timelines, we say in 3 months, 6 months, 6 months, Amy?
I'll take your steer as chair. We really don't mind. We can bring a state of nation quite soon, and then the work is ongoing at the moment. It's a part of our transformation programme as well, so we'll be pleased to report. But I don't want to bring you conclusions yet, I suppose, or findings. I just want to,
Okay.
give you an overview, and then 6 months' time, maybe an interim position.
There we are. So okay, that's fine. Thank you. Anyone else wishing to contribute? We'll move on to the second item, which is assisted technology and independent living, integrated services.
Again, I think this is one that was on last year's work plan and hadn't been sort of slotted in. So so yeah, this is more in Helen St John's area. She's not online, she's not available today. So yes, I guess again it's just sort of seeing how that's moving forward. I know there is some we've looked at some of this already. And again, it's part of the transformation program, isn't it? And it's about kind of helping us people step up and step down from levels of care and things. So again, I can't tell you without Helen here when we're likely to bring something forward for that. I don't know, Amy, I don't want to put you on the spot. It's not yours.
No, it's absolutely fine. Again, we don't mind on this one. There's work ongoing on this. Some developments planned throughout the year as well. I think if I could ask if we could, whilst we've suggested it's assistive technology and independent living, I think what we want to refer to it as is assistive technology and promoting independence, because independent living is sometimes a name for another type of service. So promoting independence. Yeah. So but again, when it can come in the year is again, we'll take your requests. Really, that's fine.
Thank you. The next one is the volunteering policy, tackling poverty. Al, is this yours, Al?
Yeah, I think this is one that is carrying over from last year with Kerry, and that just to if that can come in, I suppose, Amy, you're here, but that like as soon as possible, really, for that one.
Can I add something, Chair, as well to that? So we brought the draft policy forward previously, and we want to bring forward the management toolkit as well.
Yeah.
And there's some guidance as well. So it's the supplementary documents as well that go with it. They've been co-produced and developed with colleagues as well. So again, as Councillor said, as soon as possible, we can bring that one forward.
Yeah.
Sorry, can we put that on the first 3 months? You okay with that, Al? Yeah, we'll put that in the first
Brilliant.
3 months of work plan then, okay? So that's one for the first 3 months. The next item is tackling poverty strategy. That's you, Al, as well?
Yeah, and we're at that point of it going out to consultation. Amy, what about like a sort of January? Do you think that we'll have or perhaps no, where are we now? July? No, not that far. Soon, just to give it time to go out and then come before the committee. What do you think?
Yeah, I agree. If we can do some time between September and December.
Yeah.
Yeah. Okay.
Okay. And the next item then is again, Alison, the Poverty Truth Commission outcomes. That's a priority.
Yeah, please. And that, where are we now? July. I say I would have thought the sort of September time. They should be about ready, shouldn't they, Aim? They were had 6 months extra funding. It's finished 2 months now. August, say October.
Right, thanks, Al. And then we've got digital inclusion. Is that with Hayley?
Yes.
Hiya, Hayley.
Sorry. Hiya. Sorry I was late. I couldn't connect. I've had to turn my camera off as well, so sorry if you can't see me. Yeah, in terms of digital inclusion, I know that the digital transformation piece of work went through your committee last year. And what we're obviously hoping to build on is how we're including those people that maybe are not technological. I know that there was a big piece of work done previously where it identified that older people and those with disabilities, perhaps, so those that are not usually included in digital forms of communication, and it's a piece of work around how we tackle that basically, and how we make sure that we're being as inclusive as possible and communicating in ways that are accessible to all. So, you know, if the committee's willing to take that on, that would be much appreciated.
Thank you, Hayley. maybe I shouldn't say, but this is very close to my heart, so I welcome this year as well. So what kind of timeline, Hayley? Do you want it on the first 3 months or the second quarter?
No, I think there's with Alison's and Louise's, I think that they are maybe more urgent to be looking at. So happy to go in the second part.
Right, okay. So we'll put you in September to December then, okay?
Lovely, thanks.
Thank you. Put it back on. Enabling communities adult early help activities. Is this you, Al?
Is
Or is
Hayley
it
Hayley's
Hayley?
in line for Hayley's, yeah.
Hayley?
Yeah, sorry. As Amy has identified, there is some reorganisation going on in adult services, and there's a piece of work to look at our early intervention and prevention services then, and how we support people then to avoid having that higher level statutory intervention, but to promoting their well-being as much as possible in the community. So I hand over to Amy, really.
Yeah, this is a key part of our transformation programme this year for adult services. So as the councillor just referenced, we want to expand and enhance our early help and prevention offers. And yeah, we'd be really pleased to bring forward as we're developing this as the year goes on. So this might be one of those things where you receive more than one occasion, I suppose, just in terms of where we are now and then what our aspiration is. And hopefully the members can contribute in the development of that as we go forward.
So, Hayley, are we looking at second quarter? Yeah. Yeah. Thank you. And then we have the final one for the work plan 24-25, support for kingship carers. That's child and family. That's Lou. Yeah.
But it might be useful if we could maybe bring Julie in and see if we can, because there isn't a plan to do something specifically on this at the moment, but where you could maybe link it in with other things that we're doing. Julie, if you could chime in, that'd be helpful.
Yeah, sure. So we're doing, as part of our transformation, we're looking at sufficiency across child and family services, and what I mean by that is having the right placements for children when they need to be looked after by the local authority. So in that suite of types of placements include kinship carers, as well as foster carers, and they're both regulated provisions. And that forms part of a wider national picture through Foster Wales about the support, including payments and allowances that are available for those carers. And then there's also residential provision, both in-house and that which we externally commission, and as part of and it's all tied up in Welsh Government's Radical Reform and Eliminate, which has just come out in the new draft social care bill that's been published. So it's quite a complex picture that's emerging, and there's lots of factors and facets to it. So maybe I thought it might be helpful to bring, a bit like Amy said in one of her items, a State of the Nation about what this all might mean for Swansea's children and Swansea's services and Swansea's strategies and policies. And then out of that, we're required to produce, as part of the new social care bill, if it's passed, a sufficiency strategy, which we haven't. So that's something that will be new for us in Swansea. So that was, perhaps it could be part of a bigger picture, a larger strategic approach, which fits in really well with our current transformation plan for child and family services.
Thank you, Julie.
Could I did have two other thoughts. I'm really sorry I couldn't make the meeting.
No, that's fine. That's fine.
Some of the pieces of work we're doing that I thought that may be interesting for here as part of our transformation plan is that some joint work that we're doing across children's and adults around transitions, and what that looks like, how it can be the best it can be, not just from across the local authority, but perhaps more broadly in terms of children and becoming adults, what that means for them. So that's an area of work that we're actively working on at the moment. And the other area, again, that's part of our transformation plan, is about how we support parents and carers of children with additional needs. So we've recently done a commissioning review in partnership with education, adult services, health, and also parents and carers. So it's very much active co-production. And what that will be looking to do is inform both what we deliver in-house, but also what we commission externally within the resources we have available. So that's a live piece of work that is underway, but is still very much in its early days, if that's of interest.
Thank you. So I'll ask you, what are the priorities out of the three? Or is it just a rolling agenda?
We need to deliver against all of them at different degrees in this coming year. I guess in terms of expectations from Welsh Government, they'd probably say the first one, sufficiency.
Yeah.
But also as part of our transformation in terms of available budgets and aligning to expectations around eliminating profit, that's definitely I would probably put that as our number one priority, and we'd be needing to have a clear strategic approach locally by the autumn. And then the other two, the support for parents and carers, if we're looking at if there's implications for commissioning, we'd have to have that be clear around that before the end of the calendar year, so before Christmas. And the transition policy, I think our best hope would be that we can achieve something together within the next 6 months in terms of some draft thinking around that. We do have an existing document that we're going to refresh and update.
Thank you. Okay, yeah. I think my priority is to put the priorities in the first 3 months. Obviously, none of us got a magic wand, and we know these are big live agendas. So the first 3 months will be the absolute priorities. Then the following 3 months, then we'll start to work then into the following 3 quarters then to establish what we can over the year. So is there anything else from anyone else that they wish to add to the work plan before we move on? Alan?
Yeah, if I can, yes. I think we're trying to tackle the terms of reference for the various tasks that we've just looked at. I'm just looking at the first one, safeguarding people and harm. I mean, we don't seem to, I don't know whether this would be the right forum for it, but it might be perhaps put forward to a scrutiny committee, but we don't seem to be addressed anything to do with drug abuse or alcohol abuse. Because if we're talking about safeguarding people and harm, I mean, it is, drug abuse and alcohol would be something that does create a great deal of harm, particularly to the people concerned and families. I'm just wondering what our views would be on trying to address that issue. I mean, it is a growing problem within the city, and we get several people who express concern about the fact that it does exist, but we don't seem to be. I find that I'm on a couple of committees, don't seem to be on one that seems to be addressing this in any way whatsoever. I was just wondering what our views are on that. Thanks, Chair.
Right. Alison, first, please.
Only just to answer that, I've been sitting on the Drugs Commission for the last year or so now. It is just coming to a close, so all the findings are being written up and will be presented back. So maybe in the latter part of this this year for the committee, our response sort of thing from Swansea might well be able to come in here. We haven't touched alcohol because it's just too vast, drugs and alcohol. So the commission from the health board and the council that we've been involved with is purely looking at the drug usage because we've had so many deaths, so like I said, it's been a huge piece of work. It is coming to an end now, and then within the council we'll have to work out how we go forward with the health board and everything. So it's a bit soon at the moment, man, but maybe after Christmas we'd be in a better position, because Safe for Swansea partnership are obviously involved, PSB, it just needs a bit of time now to sort of know where we're going with it, you know?
Right, thanks for that info. I would like to see it come back here. Obviously, there's a lot of work being done. There needs to be a lot of work done. You know, and I, for one, as many of us, probably all of us around this committee and all of us were involved in the organisation, you know, probably experience in-depth conversations and the cry for help. And, you know, people do live in a very, very vulnerable world. And you know what my motto is, Al, if we can help one, I'm happy with that. But it's vast and
It is.
it's massive, out of control. But
It is.
I'm happy to hear that, you know, the work has been done, and I'm happy to hear that you'll bring it back here. So thank you for that, Al. So I'll ask again, is there anything else? Angela, sorry, I didn't see you.
That's okay, no problem. I just wanted to support Councillor Jeffries and feel strongly that it should be added to the work plan, not necessarily in the last part of the year. And I appreciate it's a complex problem, but I don't think we should shy away from what is a very, very big, important issue. Thank you.
Thank you. Nothing else? Go on, Patience.
I was just wondering how soon we can get sight of the Tackling Poverty strategy, and if at all there's any correlation between that and the outcomes of the Poverty Truth Commission.
Oh, sorry, I didn't know if Alison wanted to come in. Really linked. So the Tackling Poverty strategy is a refresh. So we had a Tackling Poverty strategy from 2017 to 2022, which we rolled into 23, and we appreciate now we're in 24, but the pandemic did stall the progress of the refresh. So we're still working on the old edition of it in terms of a corporate strategy. The Poverty Truth Commission, which has been supported by the council and a number of members and officers have been involved in it, has been running the last 18 months, and they've come up with a number of recommendations. So that's what we're talking about bringing here, not just for the council, but for lots of organisations. And what those early initial findings have been fed into the refresh of the Tackling Poverty strategy, along with a number of co-production events and links in with people with lived experience, community organisations and partners. So that work is going to carry on just in terms of the strategy refresh in the coming months. It will go out to public consultation as well. So we've brought an early draft to this group at some point in the last 12 months. Sorry, I can't remember the date of it, but we'd like to bring it, and that's what we want to bring, is the refresh of it, if that's okay. So it'll be the sort of final version that will come here post consultation, but we'd be really pleased to get member involvement in the consultation process as well, if that's okay.
Thank you. So we'll move on to item 6, which is dates and times for future meetings. They're all listed there. So we got 3. I'm happy with 4 o'clock. Everyone happy with 4 o'clock on a Monday? Yeah. There we are. Easy, Al. Thank you. So the meeting is closed, and I'll see you on the 22nd of July.
Thanks
four.
all.
Okay.
At 4
Thanks,
o'clock.
everyone.
Ta-ra. Take care,
Ta-ra.
girls and boys.
Ta-ra.